Hi everyone, I'm Dr. Carolyn Lynch Parcells. I'm a board-certified pediatrician with Girls, Women, and Young Men's Health and Wellness here in Fort Worth, Texas. I'm so glad you joined me today, and I really want to talk to you about medications because a large part of my practice actually is taking care of children and teenagers and young adults who have ADHD. And there's a good reason for that. In addition to being a physician, I am also a mom and a wife and a sister and a friend and a daughter and in general an adult human person who has ADHD and a learning disability herself. So I get it. I get the challenges that come with living with ADHD on a daily basis. There are also gifts that can come along with it for sure, but the challenges are there and they're real and they're significant. And medication can be a really important part of treating our ADHD and addressing those challenges. But there's also a lot of fear and misconceptions and I think just concerns surrounding a lot of the medications we use for ADHD that can prevent people from pursuing medication or utilizing medication as part of their treatment plan. So what I'm hoping after today, after this talk, is that yes, in addition to addressing all of those lovely objectives that are listed right there, more importantly, what I'm hoping for is that you will come away from this talk with a little bit more understanding and more of a comfort level with these medications, whether you are a physician or a medical provider, a mental health provider, coach, parent, teacher, adult who has ADHD yourself, so that you can make the decisions that are best for you or your child, or you can help guide those you serve in making those decisions. So before we jump into the actual medications themselves though, let's talk a little bit about why we use medication to treat ADHD. The research shows us that people with ADHD have better results when certain kinds of medications are used as part of their overall treatment plan. That's not to say that other modalities aren't important. Things like behavioral intervention, parent training, accommodations, those are all important, but the research shows us that people with ADHD do better with medication in addition to those things than those other interventions by themselves. We also actually have more research and data supporting the efficacy of medication than really any other intervention for ADHD at this point. We also know from the research that optimal treatment of ADHD is absolutely critical for our overall health and well-being. We know that treating ADHD ideally decreases rates of depression, anxiety, substance abuse. It improves school performance, work performance, social development, relationships, decreases accidents. In addition, we now have research that shows that optimal treatment of our ADHD is important for our overall physical health as well. Treating our ADHD helps us to do the things we need to do to take care of ourselves. Things like keeping up with doctor's appointments, taking medications that we might need to take for other health problems, taking care of ourselves in a preventative way. And as a result, optimal treatment for ADHD may actually increase our lifespan. So why do medications work? Okay, great. The research tells us that they help. Fantastic, but why? Well, we're still learning. There's still a lot about ADHD we don't know. But what we do know is that dopamine and norepinephrine, two of the brain's neurotransmitters, appear to play a pretty significant role in ADHD. The brain uses these neurotransmitters to communicate or send signals between the neurons, the cells in the brain. And if there isn't enough of that neurotransmitter, or it's not being utilized correctly by the cells, or it's being metabolized or processed out of the system too quickly, things don't work quite right. Dopamine and norepinephrine in particular affect things like attention and memory and alertness and reward and motivation, and you can see where I'm going with this, right? So what the medications, at least the stimulant medications, do is help to increase the dopamine levels in our brains so that they can work better. Now, this is not to say that medication is a magic bullet or the end-all be-all, or that it's even the right choice for every person, and it's certainly not a cure. But personally, to be clear here, I don't think we need a cure, right? As I said, there are challenges, but there are also gifts that come along with having ADHD. We can be creative, we can catch details other people miss, even if we sometimes miss the details we were supposed to get. We see solutions to problems that other people don't see, right? Even some of the aspects of ADHD that can be problems, being overly talkative and hyperactive, can come in handy. I tell people all the time, I used to get made fun of for those things. Now I get paid to do it. Medication is none of those things, but what it is a tool, right? I always tell my patients, pills don't build skills. We still have to build those skills. We still have to use those other modalities to learn how to do things and learn how our brains work and figure out how to do things differently because our brains work differently. But what the medicine does do is help us access and utilize those skills. I mean, how many times have any of us with ADHD sat there getting down on ourselves, blaming ourselves because we know what to do. We know what the skill is. We've practiced the skill before, organizing myself for this talk. But we didn't do it, okay? The medication helps our brain function better so that we can access and utilize those skills. The way I like to describe it to my patients as far as kind of what the goal of medication is, what do we expect from it, what do we want from it, is this. I like to use a superhero analogy that I came up with one of my patients. And I know not everybody loves a superhero analogy, but just hear me out on this one, okay? The way I describe it is that yes, this is like our superpower. But if you think of any superhero's origin story, their superpower was thought to be bad or dangerous even, right? Either by themselves or society or all of the above, right? Some superheroes just need to learn how to harness their powers. But some superheroes need equipment. I like to use Cyclops as an example here. Cyclops has laser beams flying out his eyeballs, right? He can't control that. He can't stop that. He has to have his visor. His visor, though, this is key, doesn't take the laser beams away. It doesn't eliminate the laser beams. His visor allows him to determine when he uses the laser beams and when he doesn't. That's how the medication should be for us. It shouldn't take away our creativity. It shouldn't take away our personality. It shouldn't make us feel like somebody we're not. And it sure as heck shouldn't take away our fabulousness, right? And in fact, I tell my patients, if it is doing those things, you need to tell me, because then we need to make a change. The medication should help us to harness those gifts, to utilize those gifts better, and to help us with the challenges so that we control the ADHD as opposed to the ADHD controlling us. So let me jump off my soapbox there now for a hot minute and let's actually get into the medications, right? So first line medications for ADHD are what we call stimulants, okay? These medications have been shown in the research to be most effective for treating ADHD. They've also been around since the 1930s. I know that one gets a lot of people. We've been using these medicines since the 1930s, okay? So there is a lot of data on efficacy. There's a lot of data on safety. We have more and longer term data on these medications than we do, like I said, any of those other interventions for ADHD. In general, all the stimulants increase available dopamine in the brain, and that's how we think that they work and are effective. And what they help with is pretty much all of those symptoms of ADHD: inattention, focus, hyperactivity, motivation, emotional regulation, impulsivity, staying on task. The other thing that's pretty great about them is they work pretty much immediately. I mean, it takes about 20 to 60 minutes for them to kick in, but once they do, they do. They're not like other medications where you have to build up over time to get max effect. Now, they are controlled substances, okay? So that means they're regulated differently, and that can cause issues with availability and cost. Side effects are pretty much the same for all of the stimulants. I'll go over some that are a little bit different as we go along. But for the most part, and this is not an exhaustive list, okay? This is the common side effects, include headache, stomach ache, decreased appetite, weight loss, difficulty sleeping, irritability, agitation, worsening anxiety, or kind of the opposite, feeling kind of blah, blunted out, kind of that zombie effect that some people refer to, or worsening mood, dry mouth, and tics. Now, it doesn't mean that you're going to have all of those side effects. It also doesn't mean that if you have side effects with one medication in one class of stimulant that you'll have those side effects in the other class. The other thing that I think is important to know with the stimulants is the dosing is not weight-based or severity-based, meaning doesn't matter if you have severe ADHD or mild ADHD. That doesn't necessarily determine what amount of medication you're going to need, nor does your size. So for everyone, for all of these medicines, we start at the lowest dose or one of the lowest doses, and we titrate step by step up until we reach the most effective dose with the least or most tolerable side effects, or no side effects, preferably, of course. So there's two families of stimulants. There's the methylphenidates and there's the amphetamines, okay? We're gonna start with the methylphenidates. So the methylphenidates, the way they work to increase dopamine is that they block dopamine from being taken back up by the cell and processed out of the system. So they keep more dopamine available for the brain to use. So all of the medications in the methylphenidate family are methylphenidate. That's the medicine that's in them. Focalin is a little bit of an exception, and we'll talk about that in a minute. But the difference between each of these is really just the way it's formulated. So the formulation can make a difference in how long the medicine lasts and kind of in what ways and in what time frames the medicine is released. What's really interesting about that is even though it's the same medicine, it's really, to this day, it surprises me how different efficacy and side effects can be from one formulation to another for one individual. So know that if you try one of the methylphenidates and it doesn't work for you, one of the other ones might. So within that methylphenidate family, there are two main groups. There's the short-acting or immediate release medications, and there's the extended release medications. The immediate release or short-acting medications usually kick in about 30 minutes, and they only last about 3 to 5 hours. So they're not what we prefer to use for first-line main medication for ADHD. Because that would require having to take like 2 or 3 doses a day, and let's be honest, we're not going to remember to do that, right? So we typically use these more for like an afternoon booster if the extended medication is wearing off too soon, or sometimes I have folks who will use it on days where they wake up too late to take their extended release, but they still need something. Sometimes though, I do have some patients for whom they don't tolerate the extended release and they tolerate the immediate release better, and so that is their primary medication. It just depends on the person. I also have a few people who use it as their primary medication because they're what we call slow metabolizers. So metabolism, when we talk about that, when we're talking about ADHD medications, we're not referring to food metabolism. We're referring to how your liver processes these particular medications. Some people are what we call fast metabolizers, which means their liver processes the medication super fast, and so the medication doesn't last as long as we expect. Okay, for other people, they're slow metabolizers. So that means that the medication lasts significantly longer than we expect. And then there's your typical metabolizers. So for example, I have a patient who can't tolerate the extended release version because she's a slow metabolizer, so it keeps her up at night. But for her, the immediate release lasts all the way through her school day. So that's what works for her. The other thing that can be nice about these medications is there's generics, and they can be a lot cheaper. So that's good too. They also come in liquid formation, chewable formation, and some of the tablets can be crushed. So if there's an issue with swallowing pills, that can be a real plus as well. One of the other issues with the immediate release formulations is they do have a higher risk of being misused or abused, used inappropriately, those kinds of things. So the long-acting preparations, there's a bunch of them now. That's the good news, bad news, right? The good news is we have choices. The bad news is there's a lot of choices. So the different formulations are listed here. I am not promoting any particular medication, but I want you to know the names of what's available out there. So again, the extended release or long-acting formulations are the preferred first-line medications. These vary by delivery system, okay? So that means they vary on how much medicine is released and when, and therefore how long they last. Typical onset for any of these medicines is going to be about 20 to 60 minutes. It varies by the person, but it can also vary based on whether or not you had breakfast and what you had for breakfast. A substantial breakfast, especially if it's got some fat in it, might actually cause the medication to take a little bit longer to kick in. Medications typically last about 8 to 12 hours, again, for a typical metabolizer, and they release medication. Most of them are formulated to release the medication in what would approximate kind of 2 or 3 dosings a day. Cost can be a real issue with these. Some of them do have generic forms, which can be helpful, but some do not, and the cost can be prohibitive for sure. Side effects, again, pretty much the same side effects that we listed before for all the stimulants. But one of the things that we can see with long-acting formulations that we don't see with short-acting is for some people, they'll get towards the afternoon, evening, but when the medicine is wearing off, they'll get about 1 to 2 hours of increased emotionality or irritability when they're coming off the medicine. For some people, it's not that bad, it's tolerable, it's not a big deal. For some people, it can be a real problem. And so if that's happening, we will sometimes address that by either changing the dose of the medication or adding an afternoon booster can help with that as well. So there's a couple of the long-acting preparations I want to point out just because they're a little bit different and there's some points that I think are important to know about them. So the first one is Concerta, which does have a generic, but this is where it gets tricky. The brand name Concerta has an osmotic release is what it's called, okay? It looks like a little Tic Tac kind of, right? But it's got a very specific release that gives it, technically the medicine's kind of comes out in about 3 doses a day, but it's pretty smooth actually of a delivery system. And it's one of our longer acting, if not the longest acting methylphenidate. The issue is that there are generic formulations that do use the osmotic release, and there's generic formulations that do not. So when you get your medicine, if it's methylphenidate ER and it looks like a Tic Tac, then you're getting the same release formulation. If it looks like a little white circle, then you're not. For some people, this actually doesn't make a whole big difference, believe it or not. But for some people, it makes a really big difference. So be aware of that. And if you are one of those people for whom it makes a difference and you need that specific osmotic release for it to work as well as you need it to work and last as long as you need it to last, you can ask your prescriber to write brand necessary or to specify the generic so that you get the right one. The other one that's interesting, that's fairly new, is Jornay PM. This is what we call a delayed extended release. This is a new formulation. So what's interesting about this one is you take it at night, about 10 hours before you want it to be effective. So we usually say around 8 o'clock at night. It releases a very small amount of the medicine throughout the night. For most people, it's not enough to affect their sleep. And then it kicks in, like I said, 10 hours after you take it. And it's supposed to last, and for a lot of people it does, until the next dose the next evening. So if you take it at 8, it would kick in around 6, and it would wear off around 8, right? So at least in theory, giving us full day coverage. One of the things that's particularly good about this is mornings. If you have ADHD or you live with someone with ADHD, you know how challenging mornings can be. So it can help with that. It also can help with the evening struggles as well, okay? It can also be sprinkled, which is great if you have someone who can't swallow pills. The downside, though, is cost and availability, okay? It is covered by some insurances, not all, and there are some coupon programs, but sometimes it can be hard to get. The other potential problem is if you do have side effects like the decreased appetite, for example, or things like that, then obviously that's going to last longer, as will the efficacy. Daytrana is another one that's unique to this class. It's a patch formulation, which can be great again for people who have difficulty swallowing pills. It can also be really helpful for fast metabolizers because you have more control over the duration. The instructions are to leave it on for 9 hours and then take it off, and it lasts for another hour to 2 hours after that. But you have more control over the duration of action. It can also help with mornings in the sense that I did have a mom one time who loved it because she could go in, put it on her son while he was sleeping, wait about 30 minutes, then go wake him up. And it worked really well for them. Downsides, though, is it can cause some skin irritation, and a lot of us with ADHD do have some sensory sensitivities, and if you're one that picks at your tags or the ridges in your socks, this one can be a little irritating, to be honest. The other issue can be cost and also availability. So the one that's really kind of the most unique in this class in a lot of ways is Focalin XR. So the difference between Focalin and the other methylphenidates is when you have these medicines in their preparation, there's actually mirror image molecules. There's the right-handed molecule, we call it the dex molecule, and the levo molecule, or the left-handed molecule. So in all the other formulations, they have both of these, okay? In Focalin, it's what we call dexmethylphenidate. So they took this one out and they just left this one. The idea is that that dex molecule was responsible for more of the efficacy and that people would have fewer side effects. And for some people that is true. For some people, Focalin definitely works better than the other methylphenidates and they have fewer side effects. But it doesn't work out that way for everybody. Definitely for some folks, the other formulations work better. One of the main things that I tend to see a little bit more anxiety with Focalin. So if I have a patient who already has significant anxiety, that's probably not going to be the one I start with. Now, does that mean that I don't have any patients with anxiety who are on Focalin and love it? No, of course. There's exceptions to every rule. That's just one of the side effects that I tend to see a little bit more with that one than I do with some of the others. One of the other things I think can be important to point out too is, I've kind of mentioned here and there things that can be sprinkled, but for folks who can't swallow pills, that can be a real challenge too, right? Because we've got to find the formulation that works, but then they also have to be able to actually swallow it, right? I've mentioned a few of them kind of as we went, but in general, that's the other thing that's been really great is we now have much more options for the extended release preparations than we used to for folks who have difficulty swallowing those pills. So there's a chewable now called Quillachew ER. There's an oral dissolving tablet called Cotempla. There's liquid, which is Quillavent XR. And then there's some of them that come in a capsule, but they can actually be broken open and sprinkled. And those are Metadate CD, Focalin XR, Ritalin LA, and Aptensio XR. Jornay can also be sprinkled. I think I mentioned that. Now, it is important, though, that when they're sprinkled, that they're not chewed, because it's the little beads that allow for that time release, that extended release medication. Okay, so that's our methylphenidate friends. Let's move on to our amphetamine friends, okay? So the amphetamine class works by increasing dopamine in the brain by increasing release of dopamine from the neurons. The difference between the different amphetamine preparations is, yes, the formulation in the sense of, much like with the methylphenidates, when is the medicine released, how long does it last, that kind of thing. But there's also a difference between some of them in the percentage of dexamphetamine. Remember how we talked about little dex and levo? There's a difference in some of the formulations between the percentage of dexamphetamine to the other amphetamines. So for example, Avikio is 50-50 dex. Adderall is about 75-25%, 75 dex, 25 levo. Now, one of the other differences with the amphetamines versus the methylphenidates is, while again, side effects are pretty much the same as those ones that I mentioned, we do see a little bit more weight loss and appetite challenges sometimes with the amphetamines. The other thing that we see is more irritability and side effects with younger children, and I have definitely seen that. So again, with the amphetamines, we have short-acting or immediate release, and we have long-acting. So with the amphetamines, the short-acting pretty much is Adderall. There are some other formulations now too, but for the most part we use Adderall, and that's also the one that has a generic. So from a cost standpoint, it's both more available and more affordable than some of the other options, but there are some other options. Can come in tabs, also comes in chewable and chewable, dissolvable, and now liquid preparations as well. So that's pretty great. Onset of any of the short actings is about, again, 30 minutes, similar to the methylphenidates. These are said to last about 4 to 8 hours. I would say in general, what I typically see is closer to 3 or 4. Again, similar to the methylphenidates. And again, that all depends on the individual person and how they metabolize these medicines. It could last longer, it could last shorter. I have some folks for whom the short acting only lasted 2 hours because they're a fast metabolizer, okay? So it just depends. Again, we typically use the short acting amphetamines as a booster dose in the afternoon, or again, if I have someone who, needs something for when they wake up too late to take their long acting. And again, these would have to be dosed usually only 2 times a day for these because they do tend to last a little bit longer, which can be pretty challenging. So again, we still prefer the longer acting preparations to the short acting preparation, at least for the primary medicine for someone's ADHD. One of the challenges too, though, that I feel like we need to point out here is Adderall, short acting Adderall, or the generic, is one of the ones that we see more issues with what we call diversion, or the medicine going to people who don't have ADHD or people with ADHD misusing it. Okay, so the long-acting amphetamines are listed here. The only generics are Adderall or Dexedrine. The rest don't come in a generic form. Again, we prefer the long-acting to the short-acting version as the primary medication. One, because, as I mentioned before, you don't have to remember it as often, but also because of the reduced abuse potential, okay? So again, similar to the methylphenidates, these all vary based on how much medication is released and when, based on their formulation, but they also vary, like I mentioned before, on the percentage of dexamphetamine present in the medication. So for most of these, typical onset's going to be, again, about 20 to 60 minutes, depending on the person and their breakfast, of course. And they last about 8 to 12 hours, depending on the formulation. Mydayis is the exception to that rule. That one is supposed to last about 16 hours, and it approximates about 3 dosings during the day. Most of the medications are going to do just that. They're going to release medication in approximately 2 to 3 kind of doses, if you will, throughout the day. And again, you can have metabolism differences, right? If you're a fast metabolizer, it's not going to last as long. If you're a slow metabolizer, it's going to last longer, okay? Cost can be a real issue here too, especially since several of these don't have generics yet, and of course availability too. Side effects are pretty much the same as what we've mentioned before. Again, with these long-acting preparations, just like the long-acting forms of the methylphenidates, you can have that afternoon, evening kind of irritability or lability at times. So a couple of the amphetamines that I in particular want to point out. So one, of course, is Adderall XR. That's kind of the long-standing go-to in this class. It lasts about 8 to 12 hours. It has that, like we said before, about 75% dexamphetamine, 25% of what we call mixed amphetamine salts. And it does come in generic, which makes the availability and affordability definitely better than some of the other options. And it approximates that kind of twice-a-day dosing. The one that really is kind of different in this class, similar to the Focalin for the methylphenidates, is Vyvanse. Vyvanse is really interesting, actually. It's what we call a prodrug. So the formulation name for Vyvanse is Liz-dexamphetamine. So what does that mean? Well, first of all, it's only dexamphetamine, okay? Similar to Focalin in the methylphenidate class is only dexmethylphenidate. So it's only dexamphetamine, but then in addition to that, there's that Liz portion. That little portion that's stuck on there is what makes this a prodrug, because the medicine has to be ingested and has to go through the gut, where there's an enzyme in the gut that will cleave off that portion, and after that, the medication can be absorbed. The medication cannot be absorbed into the system until that has occurred. So why is that a big deal? Well, because one, And most importantly, it decreases risk for abuse or misuse of the medication. But the other thing too is it does seem to help, I think, some with smoothing out metabolism as well. It can be very effective. It's probably the longest lasting other than Mydayis in this class. And it can be very effective for folks. But I do tend to see a little bit more risk of decreased appetite or weight loss with this one. I also can see more irritability or anxiety with it. Now, that doesn't mean that there aren't people who are on Vyvanse who have anxiety and do great with it and love it. But the other issue with it too is it can be expensive depending on how well or not well it's covered by insurance. Okay, so that's the stimulants. So now we're going to move on to the non-stimulants. The first ones we're going to talk about are the alpha-2 adrenergic agonists, clonidine and guanfacine. These are actually old school blood pressure medicines. And we don't know exactly how they work in ADHD, but what we do know is that they stimulate inhibitory neurons that decrease sympathetic outflow. Basically, the sympathetic nervous system is part of the fight or flight response, and for lack of a better term, these medications help chill that out. Which is interesting when we think about how we use them in ADHD and how they affect those of us who have ADHD. These medications are really best for hyperactivity, impulsivity, irritability, aggression, sleep, and even emotional regulation. Interesting. They're not as good for focus or attention, and they haven't been shown to be as effective as stimulants, at least not on their own. So typically we're using these medications as adjuncts or in addition to the stimulant medications. So for example, for somebody who hasn't been able to reach optimal symptom control on a stimulant alone, or someone who isn't able to tolerate a high enough dose to reach symptom control on that stimulant alone. Now we will still sometimes use these medicines on their own for people who maybe can't tolerate a stimulant medication or can't take a stimulant for some reason. Okay? And similar to the medicines we talked about before, there are both long-acting and immediate release preparations of these medications. So the ones we use most commonly are the long-acting version of guanfacine, which is Intuniv, and the long-acting version of clonidine, which is also known as Capve. Intuniv is really the one that we kind of see used the most, though, of those two. They're usually dosed in the morning. They may require some titration. We start at the lowest dose and we work our way up. They last 12 to 24 hours and they kick in pretty quickly, but they can take up to 2 weeks to reach max effect, okay? Side effects are generally pretty mild. It's mostly fatigue, sleepiness, a little dizziness, but we can see some low blood pressure, and stopping them abruptly is not usually a good idea because that can increase blood pressure and also cause some nervousness or irritability. So some of the other downsides to the medicine is you pretty much need to take it every day. Like I said, it's less effective than stimulants on their own, and for the long-acting preparations, they have to be swallowed. They can't be crushed. So that can be a problem if you have a child or person who has difficulty swallowing pills. The other thing that's interesting about these medications is they can actually be helpful for those who have tics in reducing tic frequency, and as I mentioned before, can be really helpful for sleep. In fact, the short-acting versions are actually more helpful for sleep than the longer-acting versions. So the immediate release or shorter-acting versions of clonidine and guanfacine are also used sometimes, but we typically use those more at night to help with sleep in folks with ADHD because they can cause a little bit more sleepiness. The other time that we'll sometimes use them, though, is for those folks who can't swallow pills because they can be crushed. We do have to watch that they don't create too much sleepiness during the day, though, and they have to be dosed 2 or 3 times during the day, not only to reach max effect, but to also make sure that we're not having ups and downs with the blood pressure. One of the other non-stimulants is Strattera, or the generic name is atomoxetine. Strattera is what we call an SNRI. It's a selective norepinephrine reuptake inhibitor. So basically what that one does is it increases norepinephrine levels in the brain, that other neurotransmitter that we were talking about. The dosing on this one is weight-based, but you have to start at a lower dose and titrate up to the correct dose for weight. And it can take 6 to 8 weeks, even 12 weeks to reach full effect, which is one of the main downsides of it. On the other hand, it is only dosing once a day and gives 24-hour coverage, and it's not a controlled substance, right? So those are all good things. However, it's definitely not as effective as the stimulants. We see that in the research, but I'll be honest, in my own clinic, I see that a lot as well. Side effects can include nausea, sleep disturbances, dry mouth, worsening mood, even to the point of suicidal ideation in some people. This is another one that, like I said, has been shown to not be as effective as the stimulants. So in general, we are usually using Strattera either as an adjunct to a stimulant if someone isn't able to reach full effect with a stimulant alone, or again for those folks who either can't tolerate a stimulant or can't take a stimulant for some reason. A couple of the other non-stimulants I'm just going to mention here. I'm not going to really go into too much detail because they're more third line medications, but I do want you to be aware of them, are Wellbutrin, or the generic name is bupropion, and the tricyclic antidepressants. These medications are further down the line, but have been shown to have at least some efficacy with ADHD, although certainly less than the stimulants, and sometimes can be used if there's also a comorbid or coexisting condition such as depression or anxiety. So now that we know what the medications are and why we use them, how do we get started? I always tell people to start with your primary care provider. They may be comfortable with ADHD and managing these medications. They also might not be. If they're not, they'll probably refer you to either psychiatry or child development or neurology or another primary care doctor who is more comfortable with the medications and managing ADHD. Once you find that provider, how do we figure out what medication to start you on? Well, a lot of that is going to depend on the age of the patient. Based on the guidelines that we have, kids ages 4 to 6, this is actually the one time we don't recommend starting medication first line. We recommend starting with parent training, behavioral management, and classroom interventions, because in this age group, they've been shown to have a higher risk of having side effects from medications like stimulants. With that said, though, if those initial interventions are not sufficient, it's still okay to start medication. And in that age group in particular, we recommend starting with methylphenidate based on the guidelines. For kids 6 to 12, we recommend starting medication, as well as parent training, behavioral management, and classroom interventions. For kids ages 12 to 18, we recommend medication plus behavioral interventions that are appropriate for their age and classroom accommodations. And then for our adults, again, the guidelines are still to start medication and then accommodations, skills training, behavioral modification as appropriate. Once we've looked at age and those kinds of factors, we look at personal history. We look at family history. Is there anybody else in the family who's been on medicine? Have the medicines worked for them, or have they had side effects? Are there any other conditions we need to take into consideration? Anxiety, depression, other medical conditions. Once we've looked at all of that, we have to make an educated, honestly guess, based on the data we have, pick a medicine we think is most likely to be effective and best tolerated, and try it. We really don't know until we try. So in particular with the stimulant medications, once we choose a medication, we start at the lowest dose, or one of the lowest doses, and we titrate. We go up on the dose gradually until we reach the dose that is the most effective with the least side effects. The good news is we can actually titrate these medications pretty quickly, okay? Every 3 to 5 days, actually. I usually use 7 days just because that's easier for people to remember, but we can adjust the dose faster than that if it's safe and appropriate for that patient and if they're not having side effects. Now, if someone's having side effects, here's one of the keys. It can take up to 2 weeks for those side effects to go away. For some of them, it can take a little bit longer, like appetite takes more like 4 weeks. So I always tell my patients, if the side effects are mild and they're tolerable, try to stick with it, taking the medication every day for at least 2 weeks. That's another key. It's taking the medication every single day for at least 2 weeks to see what the side effects are going to do, okay? Now, oftentimes we have to try different doses. We may have to try different formulations. We may have to try multiple different medications at multiple different doses. We may have to try adding some of those adjunct medications that we talked about. So sometimes we're lucky and we hit the nail on the head pretty quickly, but a lot of times it can take time to find the right medication that works for somebody. I have a lot of patients that I see who have come into me because they tried medication once and it either didn't work or they had side effects and so they stopped, sometimes for years. It's not always an easy process. It can be frustrating, but stick with it, okay? It can absolutely be worth it. So let's circle back around to those myths and misconceptions that I mentioned. I think one of the biggest ones I hear on a regular basis in regards to stimulant medications is that they're addictive or can cause addiction. And this is one that I feel like is really important, and it's very important for me to be very clear on this one. When these medications are used properly under the guidance of a medical provider and taken appropriately, they have a very low risk of abuse and dependence. Okay? Furthermore, the research shows us that people with ADHD, when their ADHD is treated properly, have decreased risk of drug use, drug abuse, and drug dependence. And I see it all the time in my clinic. It breaks my heart when I have a young person walk into my clinic who is now smoking weed or vaping nicotine or vaping THC because they're self-medicating their ADHD or the depression or the anxiety that came out of trying to deal with their ADHD. It makes things so much harder. Now, I am not saying that these medications cannot be misused or abused or diverted to others who don't have ADHD. They can and they are, like I mentioned before, especially the short-acting formulations. So we do have to take these medicines seriously, and I do take those issues seriously. But the other problem with this whole issue is because there is that concept out there that these medications can cause addiction and can be misused, it makes it hard for those of us who do need them to get them, right? Because it prevents us from asking for them. Sometimes we get looks from pharmacists or physicians or other medical providers when we are asking for our medication. Sometimes the medication is not available because it is a controlled substance and therefore the supplies are limited. All of these can be major challenges and major barriers to us getting optimal treatment for our ADHD. One of the other big ones I hear a lot is that medication should be used as a last resort, or that we should wait until a child's grades are going down or someone's not doing well at work. No. We should not be waiting for people to be in crisis to start gold standard first-line treatment. We don't do that with any other medical problem. We shouldn't do it with this one. We should be preventative. Grades, if we are waiting for, first of all, ADHD is not just about school, right? It affects our entire lives. But in addition to that, yes, a child can make A's and B's and still have ADHD and still need medication and still need accommodations. They may be making those A's and B's, but at what cost? Lack of sleep, depression, anxiety, low self-esteem. That's how a lot of the girls in particular, especially girls who are high achieving, maybe have anxiety and have inattentive type ADHD, fall through the cracks. We don't want to wait for someone to outwardly be in crisis. We want to be proactive. We want to be preventative. We want to have somebody on an optimal treatment plan as soon as we know that they have ADHD. The other one I hear, again, primarily with the stimulant medications, is that they're dangerous, or we're worried about long-term effects, or worried about side effects. Again, like I said, these medications should be taken seriously, but again, we've also been using them since the 30s. We have good data. We still don't know everything about them, certainly, and we're learning new things every day. But based on the data we have right now, we know these medications to be effective, we know them to be relatively safe, and we know that severe reactions are very, very rare. Here's the other thing. There are side effects to not taking medication. There are side effects to not optimally treating our ADHD. As I mentioned before, drug use, depression, anxiety, accidents. I tell my teenagers with ADHD, they better be taking their medicine when they start driving, okay? There are consequences, there are side effects to not optimally treating our ADHD, and we have to take that into consideration. Last but certainly not least, let's talk about shame, shall we? This is a big one. I think whether you're an adult who has ADHD, or you're parenting a child with ADHD, or you're both, There is this sense that we shouldn't need medication, right? I'm a physician. I own my own business. I shouldn't need medication to get my kitchen clean. I shouldn't need medication to get everybody out the door and to school on time, right? If you're a parent, is it a replacement from parenting? Is it because I failed as a parent? Am I medicating them for them or for me because I can't handle it? Parenting a child with ADHD is different. It's different than parenting a neurotypical child. It just is. But there's this sense that we shouldn't need medication or that medication is failure. There are always going to be those voices, I think, that judge whatever decisions we make. Those voices aren't going away. But it is not failure. Asking for what you need, asking for what your child needs, advocating for yourself or your child or your client or your patient is never failure. It's doing what we need for ourselves, for our children, for our clients, for our patients. It's taking care of ourselves and it's taking care of them. And you should never be ashamed for that. Thank you so much for taking the time to join me. I really hope this was helpful, and I look forward to meeting all of you in the live question and answer session.